Recently we have been introduced to the robot by Elon Musk, the Optimus robot, which is intended to act like a human and help household and other activities. And interestingly, there is a link between this new technology of the Optimus, especially the artificial intelligence that is going to be implemented in this robot, and psychiatry. So what is the link? The link is that this robot will have to be operating in human-like activity using AI, and AI is actually based on architecture and functional characteristics of the brain. They are actually models of the brain, imitating the brain. So we have a physical system imitating the human behavior and human experience, and this simulation simulates some of the cognitive and maybe mental functions of humans. And in psychiatry, we are interested in disturbances to the mental functions. So we have a basis here for simulating pathology, psychopathology, and getting insights from the disturbance that cause this phenomenological pathology, which is actually a metaphor of the disturbance in the clinic of the patients. And then we get the insight from the device, from the artificial intelligence about what may cause such a disturbance like that of the mental functions. So this brings us back to a whole field of research that has been developing in the last years of a simulation with artificial intelligence or with models, mathematical models of the brain and simulation of disturbances in the brain. And this brings me back to a paper that we published many years ago. We were one of the first to go into this field, and we actually simulated a thought process. So in the thought process, it is actually, thought is also consciousness. So we built a neural network model, a simplified brain model, and the model had many states. Each state can represent some kind of concept or conscious experience. And when you have a normal thought process, you have an association between one concept and another, creating a stream, a trajectory of activity like in the brain. So in the brain, you will have like a state, which will be an activation of a set of neurons. In another state, activating another set of neurons will represent another concept. And the normal thought process is moving from one state to another, so you can actually move from one state to another, creating a trajectory. This trajectory will simulate the thought process, the organized thought process. Okay, and the rest of the space of this system are all the possible thoughts or experiences that the brain can handle. And now, in the past, what we did, we generated a very simplified model, moving from one state to another. And by creating disturbances to the connectivity, we could simulate, metaphorically, clinical manifestations that we see in the clinic. So, for example, if a patient has loosening of association, he's jumping from one concept to another without any relationship between them. In this case, what happens in the model is that it jumps from one state in the state space of the model to a distant one without any connection between them, just jumping from one state to another in an uncoordinated way. Another thought process that we see in the clinic is perseveration, where the patient perseveres and activates the same thought and the same experience over and over again, and he cannot actually get out of this state. And in the sense of a system, that would be called an attractor, in the sense that there is a state in the system that is strongly connected by the units, and it causes the units to activate each other in such a way that every time the system will go into that attractor. It's just like a hole in the ground where a rolling ball is trapped inside. So, as you can see, when we have this robot, he will have to be able to understand the environment, to activate experiences, to be able to represent internal representations, activate them. That would be like his thoughts. And he can also suffer from disturbances to that process, which we will probably not want. The engineers will probably eliminate such a disturbance, but in potential, if the elements will be unconnected or disconnected, the robot could become confused and have loosening of activations, or it could get stuck in situations that are unadaptable, and in this way it can give us an example of a mentally disturbed robot in this sense. But apart from that, it's nice to think about a psychotic robot or a mentally ill robot, but in reality what is important and what is critical is that we have a physical system, which is the artificial intelligence embedded in that robot, and it can help us explain a phenomenology that we see in the clinic to the extent that it will reveal the etiology, reveal the disturbance itself, which is causing the phenomenology, and by that we will discover the causes of mental disorders. So this is a link between Optimus, the robot, Elon Musk work, artificial intelligence that is being developed for many years, and the idea, and necessity, the need to find the etiology of mental disorders.